Singapore is seeing a rise in cataract surgeries as its population ages, with the Singapore National Eye Centre performing some 18,000 of them yearly. But thanks to a new treatment, patients going through it can soon worry less about developing inflammation and other complications, often caused by inadequate or incorrect applications of steroid eye drops post-operation. This comes as the COVID-19 pandemic highlights a rising importance for more medical treatments not needing any action on the patient's part. For more, we're joined by Dr. Wong Chee Wai from the Singapore National Eye Centre's Surgical Retina Department. Dr. Wong, for those who might not be too familiar, cataract surgery involves replacing the cloudy lens of an eye with artificial ones. How often do you see patients suffer from complications post-surgery, and how serious can it get?
So cataract, as you have rightly pointed out, is an age-related condition that all of us will eventually get as we grow older. The natural lens in the eyes become more yellow. Sometimes it becomes white, and that's what we call cataract, and it can cause blurred vision. So patients undergo surgery for that. So after surgery, the most common problem patients will have is inflammation that happens after every cataract surgery. And sometimes if the inflammation is not adequately controlled, you can get swelling in the central part of the retina, called the macula, which you can see in this cross-sectional scan of the retina here. The black spaces represent the swelling within the retina. And this can cause prolonged periods of blurred vision after cataract surgery that can take months before it resolves. And rarely, some patients with inadequately controlled inflammation can also develop complications like glaucoma that can lead to impaired vision in the long term as well.
Dr. Wong, this new treatment, it involves injecting a drug into the eye after the surgery is done. Can you explain what exactly this drug does that prevents complications like inflammation, and are there risks involved?
So this is a new type of treatment. It's a nanomedicine-based drug delivery system that delivers steroids into the eye. So the nanomedicine in question here is what we call liposomes. And these are lipid nanoparticles, which are only about 100 nanometers in size. So for context, the thickness of a single strand of human hair is 100,000 nanometers. So it's 1,000 the size of that. So the liposome envelops or wraps the steroid, which is the active drug, and it confers several advantages for drug delivery. So the first would be that by wrapping the active drug in the liposome, what you get is that the liposome resists degradation and loss of the active drug as it travels into the eye, into the inflamed sites where it is needed. And then second, the liposome also helps to shield other parts of the eye, the non-inflamed parts of the eye, from the active drug. So that also prevents unwanted side effects at these other sites. And lastly, but most importantly, is the fact that these liposomes are very attractive to inflammatory cells. So inflammatory cells like to eat these liposomes. And when they eat up these liposomes, the liposomes release the payload, which is the active drug. And that's where the active drug can then exert its maximal anti-inflammatory effect.
And is this new treatment then suitable for everyone undergoing cataract surgery?
So I would say that it's suitable for the vast majority of patients. Rarely, some patients may have scarring of the conjunctiva, which is a superficial layer in the eye, and that may make it difficult for us to inject the drug. And second is a group of patients, a small percentage of patients who develop exaggerated response to steroids that cause a rise in the eye pressure, and that can lead to glaucoma. So in general, these patients, they should not be receiving any form of steroid therapy.
Dr. Wong, we have a great need for cataract surgery in Singapore as the population ages. How soon are we expecting to see this treatment become available? And perhaps, I know it's the early stages, but how much could it likely cost in relation to current treatment methods that we have?
So in response to your first question, we are hoping to get it out as soon as possible. But the typical life cycle of a drug from the laboratory to clinical trials and finally to regulatory approval typically takes about at least 6 to 8 years. And we have set up a spin-off company from the Singapore Eye Research Institute called Eden Ophthalmic that is basically set up to further develop this formulation and to commercialize it in the future. Response to the second question about the cost, certainly we want to make it as affordable as using steroid eye drops. It's also useful to remember that a single injection of this new treatment is able to replace 126 applications of the eye drops. So it not only helps to reduce all the complications associated with inadequate suppression of inflammation, it also makes it a lot more convenient for patients, especially elderly who are not able to instill eye drops properly most of the time and may require caregivers. So definitely the cost will be commensurate with how much benefits the patients will receive from this treatment.
All right, many thanks for your thoughts this evening, Dr. Wong Chee Wai, consultant at Singapore National Eye Centre's Surgical Retina Department.